Nearly 10 out of every 100 pregnancies result in the development of gestational diabetes. Well, here to share more on the causes, prevention, and treatment is Dr. Emily Rosenberg, Medical Director for MUSC's Diabetes Management Service. Good to have you with us.
Hi.
Learning some very interesting things about gestational diabetes, and that is a particular type of diabetes that develops when someone becomes pregnant.
Yes.
But not in everybody.
Yes, so it's sort of a unique type of diabetes because it's only present during pregnancy, and typically it goes away after the placenta and the baby are delivered. As you mentioned, it is fairly common, and that's why we screen all women who are pregnant in this country for gestational diabetes, around 24 to 28 weeks gestation. And the reason that it happens is the placenta actually makes hormones that make your body's insulin not work as well. So women become more insulin resistant, and for some women, their pancreas is not able to make enough insulin to overcome that insulin resistance that develops in pregnancy. So that is why we screen everyone for gestational diabetes
and if
in
you're
pregnancy.
If you're a fairly healthy person, or you think you're a healthy person, and then you do have a risk of developing gestational diabetes, are there ways to prevent actually being diagnosed with that? Are there things to eat or things to drink? A more holistic approach to avoiding going down that road?
It's a good question. I think healthy lifestyle, eating, exercising, gaining the appropriate amount of weight in pregnancy are important ways to be healthy and reduce your overall risk of developing diabetes in general.
So who would you say is most prone to developing gestational diabetes?
So women who are at risk factors for type 2 diabetes, so overweight, sedentary lifestyle, or not exercising, and age, of course, is another factor. So with the rise in obesity and older ages of women becoming pregnant, we've seen a rise in gestational diabetes in our country.
How would you treat it? So if you do diagnose a mother who is carrying a child, how do you treat that?
So most women, the majority are actually treated with lifestyle modification, which is great. So they engage in dietary changes and exercise. They see a nutritionist, and most women can do well and not require what we call pharmacotherapy for gestational diabetes. But you know, around 30% or so of women will require treatment, and we typically use insulin for treatment.
Oh, you do? You do, okay. What is the effect on the baby?
Yeah, so glucose or sugar crosses the placenta, and in the beginning of pregnancy can actually affect organ development. We also know that babies born to moms who have diabetes are at higher risk for being large, so being large for gestational age. Babies are also at risk for things like having a low sugar after they're born. But the good news is that treating the glucose, so treating the mom's sugars, can actually reduce these risks.
So let's talk about the M.U.S.C. program that you do have in place to help moms if they do find themselves with that diagnosis.
So our program, the MOMS program at M.U.S.C., it's actually part of a statewide initiative to sort of improve the care of moms who have diabetes when they're pregnant. And so at M.U.S.C., our program, we offer sort of in-person visits, which is great, and we also offer telehealth, so women can do virtual visits as well. We have a multidisciplinary clinic, and we sort of provide comprehensive care. It allows women who are pregnant with diabetes to come in, see their maternal fetal medicine doc, see their endocrinologist, and also get their ultrasound all at the same place.
Do you have to have a doctor within the M.U.S.C. network in order to take advantage of this?
That's a very good question. Not necessarily. So we do get a lot of internal referrals, of course, but we also do get external referrals, and we can. You can also self-refer yourself, do a self-referral to our program as well.
Perfect. All right, Dr. Rosenberg, thank you so much for joining us. Appreciate it. We're back after this.